name's Brian, and I'm a psychiatric mental health nurse practitioner student. And today I'll be giving a presentation on my signature assignment integrative therapy video. So first, let's begin with my patient. Her name is Sarah for the purposes of this video. She's a 26-year-old white female who's been married for a year now and has been employed as a graphic designer but is currently on leave. Sarah was raised in a family where mental health issues such as schizophrenia and bipolar disorder were stigmatized. Her family history and cultural views on mental illness contribute to her hesitancy towards consistent treatment. So Sarah was recently diagnosed 1 year prior with schizoaffective disorder, bipolar type, following an episode. She presents today during her pregnancy having not taken medications that she's been on for stabilization for about a month now, which included lithium for mood stabilization and Risperdal for psychosis. Since she stopped taking her medications, she has been experiencing worsening delusions, including the belief that her baby is actually an alien implanted inside of her by extraterrestrials. Additionally, she exhibits severe mood swings and occasional paranoia. So her diagnosis for today is going to continue to be schizoaffective disorder, bipolar type, and her hallmark symptoms are her delusions, of course, that her baby is actually an alien, her severe mood swings, including manic episodes, paranoia with some auditory hallucinations, and a history of aggression and poor impulse control during her episodes. So during our visit today, I'll be using two different skills to help treat Sarah's symptoms from two different types of therapy. The first one is known as reality testing. This is a skill from cognitive behavioral therapy specifically geared for psychosis. This is to help patients address psychotic symptoms by addressing their distorted thinking patterns and reinforcing reality-based interpretations. Reality testing helps to evaluate the evidence for and against their delusions. This skill has strong evidence, and it has been shown to reduce distress associated with psychotic symptoms and help improve patients' functioning. Its intended outcome is to help Sarah recognize that her belief about the baby being an alien is actually a delusion, and gradually reduce her distress and conviction around this belief. So for my first therapy that I'll be demonstrating, cognitive behavioral therapy for psychosis, this is called reality testing. So we're going to start with Sarah and I seated comfortably in my office. I'll start the interview. Hi, Sarah. Today I'd like us to work on a skill called reality testing. This will help us to look at evidence for and against some of the thoughts you're having. Is that okay with you?
Yeah, I guess so. I just feel like no one believes me.
I understand. It can be really difficult when your experiences feel so real. Let's take it step by step. Can you tell me more about your belief that your baby is an alien?
Well, I know it sounds crazy, but I feel like I was abducted. I woke up one morning and it just felt like something was put inside me. The baby doesn't feel human.
It sounds like this belief is really distressing for you. Let's try to look at the evidence together. Have you had any medical scans or doctor's visits since you found out you were pregnant?
Yes, I had an ultrasound last week.
And what did the ultrasound show?
They said everything looked normal. The baby's heartbeat was strong.
Okay, that's good to hear. So the medical professionals didn't see anything unusual?
No, they didn't, but I still feel like something isn't right.
I understand that feeling is very real to you, but let's consider this. The ultrasound showed a healthy human baby. Is it possible that this feeling might be part of your psychotic symptoms?
Maybe. I don't know.
It's okay to feel unsure. The goal here is to gently question our beliefs and to see if there's other explanations. You've had thoughts which were out of touch with reality before, and with the right support, you've managed them. We'll continue working on this together. And for our second skill, we'll be going over the stop skill. This is a sub-skill from Dialectical Behavioral Therapy, or DBT. and combines cognitive behavioral strategies with mindfulness to manage intense emotions. Distress tolerance skills help individuals cope with crisis situations without resorting to harmful behaviors. The stop skill, or stop, take a breath, observe, and proceed mindfully, helps to manage impulses during intense emotional distress. It also has strong evidence with it being proven effective in reducing impulsivity and emotional dysregulation in patients with mood disorders and co-occurring psychosis. Its intended outcome is to help Sarah manage her mood swings and avoid her aggressive outbursts, especially during moments of paranoia or distress. Sarah, it seems like you're feeling really upset right now. Let's try a skill called STOP to help you manage these intense feelings. It stands for stop, take a breath, observe, and proceed mindfully. Are you ready to give it a try?
Okay, I'll try.
Great. First, let's stop. Just pause for a moment. You don't have to do anything right now. Now, take a deep breath, in through your nose and out through your mouth. Good. Now let's observe. What are you feeling in your body right now?
My heart's pounding and I feel shaky. I'm really angry.
That makes sense. Can you also look around the room and notice what you see and hear?
I see you, the chair, and the clock ticking.
Perfect. Now let's proceed mindfully. What can you do next that will help you stay calm? Maybe sitting here a little longer or talking about what made you feel this way.
Talking about it might help. I feel a little calmer now.
That's great, Sarah. You use the stop skill to pause and regain control. We can practice this whenever you feel overwhelmed. Today, we practice two skills: reality testing from CBTp to address your delusions, and the stop skill from DBT to manage your intense emotions. These skills are evidence-based and designed to help you cope with the symptoms of schizoaffective disorder. With continued practice, you can regain a sense of control and stability. Thank you for working with me today, Sarah. We'll keep building on these techniques together.
Thank you.
So now we've seen firsthand how CBTP with reality testing helps to manage Sarah's delusions, and how the other skill, DBT with the stop skill, helps to manage her mood swings and her impulsivity. These approaches are evidence-based and tailored for her diagnosis, and with the proper assistance and training on how to use them, it'll be very effective in managing her symptoms. Again, my name is Brian Erb, and I appreciate y'all for watching.